Namaste. Psychoanalysis and spirituality, thus Mahavidya, in continuation to our previous recordings, the 10 Mothers, Kali. Namaste, sir.
Namaste.
Sir, as this discussion is getting more profound, we would like to understand what is the process of transformation practiced here in the concept of thus Mahavidya and Kali.
One thing is common to all the Mahavidyas, and that is the process of transformation is very intense. In Sanskrit language, we call it Shigra, Ugra, and Tivra. That there are many ways of self-transformation. Mahavidya is not the only way, but this is an intense way. Just as you have many forms of psychotherapy, but ISTDP is an intense form of psychotherapy. So this brings us to a very important element. I'll just take a small digression and come back to it, the question. Digression is towards a concept in psychoanalysis called the types of patients, and a concept in Mahavidya called the types of aspirants, sadhaks. If you go back to Kernberg's classification of all patients, he would classify all patients into 4 categories. Category 1, those who cannot be taken in psychoanalytic psychotherapy. They are too fragile. Just the imposition of the frame itself creates problems for them. The anxiety, the disintegration becomes unbearable. The evocation of affect becomes beyond control. It leads to what I call destructive affect mobilization, DAM, D-A-M. And I always say damned if you damn. So he says this category should not be taken in psychoanalytic psychotherapy. They can try other forms, but not this. Second category of patients, he says, are those for whom we can only practice soft holding techniques, largely cohesion techniques, but they are still not ready for difficult interpretations. You can think about very fragile narcissistic patients. Everything is okay till you give a difficult interpretation, and it creates such difficult events in the inner world that most of them stop coming to therapy.
True.
The third category is they are ready for interpretation, and they are the real core constituency for psychoanalytic psychotherapy. And the fourth category is they are ready even for challenge and confrontation. This is the category ready for very intense kind of therapies like ISTD. And one of the ways to look at progress in psychotherapy is to see how the patient moves from category 2 to 3 to 4. Now you can have a similar kind of concept in Mahavidyas. You can divide people into 4 categories. One, the normal category of people whom you cannot take into Mahavidyas. They are fine with normal ways of worship. They are fine with right hand path of Tantra, central path of Tantra, but not with the left hand path of Tantra. They are fine with Vedantic worship. They are fine with Bhakti Marg. They are fine with Karma Marg, but not with this kind of intensity. So category 1 would be those who cannot be taken into Mahavidya. Category 2 will be those who can be taken into Mahavidya but can practice only the Saumya form of Mahavidya, like Lalita Tripura Sundari or Kamala. The third category would be those who can practice Saumya Tivra Saumya Ugra form of Mahavidyas. Those who are partly this and partly that. And the most heroic category would be those who are capable of doing the worship of the most Ugra form of Mahavidyas, in which Kali would be there, Chinmasta would be there, Dhumavati would be there. So if you look, it's almost like a parallel to psychoanalysis, that you divide people who want to come in into 4 categories. Now, one way to put this 2, 4 and 4 together is to create a continuum of 8. That you go from 1 to 2 to 3 to 4, and then when you are cured, you get into normalcy, which is the 1 of Mahavidyas. So from, if you look at 1, 2, 3, 4 of Kernberg and 5, 6, 7, 8 of Mahavidya, then 4 is the category where the patient is ready for confrontation and challenge. Let us say he gets well, so he becomes a normal person without any pathology. And after normalcy, he goes into the next category of Saumya, then Saumya Ugra, and then Ugra. This is one way to look at it, that from extreme fragility to extreme strength. One end is so fragile that you cannot even take for psychoanalytic psychotherapy, and the second end of the continuum is so strong that he can even do the Ugra Mahavidya sadhana. So that is one way to divide humanity in terms of psychological health and spiritual health. But it is not exactly this, because there are some exceptions in this situation. There would be people where they are ready for confrontation or they are ready for interpretation, and the problem is such that if they do some Mahavidya, temporarily it will escalate and create more intense problems, but it will solve not only their pathological issue, but also take them into the Mahavidya realm eligibility. So it is not just a continuum, there are ifs and buts, and there are people who would be in psychoanalytic spectrum. And the normal idea would be that because psychoanalytic spectrum is on the left-hand side of normalcy, right, and if the normal cannot be taken, obviously the left-hand side of the normalcy cannot be taken. But actually what happens is that there are some people who are into therapy, but are ready for Mahavidyas. And these are exceptions. So that also is one aspect, that it is not just a continuum, but there are some people who can jump from the left of normal part into straight into Mahavidya. That is a judgment to be exercised by the Guru. So with this digression, I will just come back to it, how the process of transformation is achieved. The process of transformation is achieved by confronting the worst parts of oneself and bringing them up. You are not moving slowly, but you are directly moving to the worst parts of yourself, the most repressed parts of yourself. And it is a forced encounter with the most difficult part of oneself. It is a merciless operation upon oneself in a psychological sense. And the transformation is brought about by not only following the process which we saw in the introduction, that how the Mahavidya sadhana essentially happens. It starts with finding a guru. The guru takes a stock of you. He gives you some preparatory things to be done. When he is satisfied, he gives you diksha. And after taking the diksha, the guru decides how you will go about into the Mahavidya process. Whether you will do all of them, some of them, start with the Ugra, start with the Saumya. And then you start, and then there is this whole process of yantra, mantra, tantra, lifestyle, and so on. But the core is you start relating to the deity, and in some sense, there is a virtual presence of the deity with you. And a conversation starts between you and the deity. And this is just below the threshold of psychosis. This is not hallucination. This is below that. There is clear insight. And you see the deity in the inner world, not in the physical sense as in hallucination. But there is a conversation with the deity in some way or the other. And this continues into a relationship. And in
Sir, to gauge what you just said, that one is the insight and one is the hallucination, a person himself or herself can gauge this. How a therapist would be able to gauge into this? Of course, I'm not talking about the fully blown psychosis, but in the initial stages when it is getting onset, how would we demark whether it is an insight or it's an hallucination? Because sometimes the insight, for example, people do refer to Ramakrishna Paramhansa, where he talks about Kali as if he is into a psychotic mode, according to Western psychologists. While in India, we give it a twist because we know overall his intellectual understanding and the insights had some more wisdom added to it. So, I'm sorry, I might deviate the topic, but I was just becoming very curious at this very point that how would the outsider gauge if it is an insight or is it a proper hallucination?
Yeah, it's a very good question. In fact, there is a book on this called Mad and Divine.
Okay.
By Sudhir Kakkar. And he precisely takes up the example of Ramakrishna Paramahansa.
Okay.
And as you said, it's correct that some of the criteria can overlap with DSM. And this leads to two possibilities. One, the limitations of DSM itself. That DSM has been created for ordinary people and ordinary life. It is not created actually to look at rare experiences. And therefore, rare experiences can wrongly get classified as psychosis. That is one aspect of it. Second aspect of it is, how do you look at the person overall? Is the person dysfunctional or functional? That is a very important criteria. Okay. Ramakrishna Paramhansa, was he functional or dysfunctional? So his work was as a pujari of that mandir. His work was to preach, and there was no problem in that work per se. But his ideas were very different from a consensus reality. Now, the second criteria apart from functionality is, this is very important. I think this is the most important criteria. Is the person doing something on the spiritual path, or have these experiences come on their own with their own force, where the unconscious is forcing itself through? Now, if you do some spiritual sadhana and then the experience comes, it can be a 50-50. It may be that you are hallucinating, it may well be. But it can also be that it's a genuine spiritual experience because you are looking for it and you worked for it. Does that mean that the moment you work for it, you will definitely get it? No. And is it not possible that if you don't get it, you can hallucinate it? Of course, it's possible. But when you look at the person in totality, when you talk to him, when you see how he has got to where he has got to, by and large, it is not easy. The question is right. There is a very thin line. And how does a person from outside know it? Now, if he goes to a psychiatrist, probably the psychiatrist would not know it and he would classify him as a psychotic. But that is where the skill of the spiritual guru comes in. Because your guru has gone through the same process where this process starts and this process ends, or this process continues without any dysfunctionality of life. Rather, it adds functionality to life.
But sometimes when people have this spiritual awakening, there is a loss of sense of the connections of the materialistic world, and they withdraw, and it can again be misleading.
That is a state of bliss.
Bliss.
Now, the question there would be, is the state of bliss attained after purification of the chakras, or are the chakras as they are and one part of the person has shot into bliss? If one part of the person has shot into bliss with other parts of him remaining unpurified, that can be a regression to primary narcissism. And that is what you will see in some cases of psychosis with negative features, what I call the happy psychosis.
Yeah, was or a kind of blissful mania.
Yeah, but it endures.
Soft mania.
Yeah, unlike mania, it endures. Like in mania, you will see it coming down after some days because the body can't take it. The lower cycle of bipolar will be much longer than the upper cycle.
Upper side.
But here you will see the upper thing going on for a long time. That is either because of regression to primary narcissism or because of a long-term use of manic defense. That inside there is a pain, and the pain continues. Until the pain continues, the manic defense continues to be used, and the person remains on a high because of that reaction formation. So mania will be short term. If it is long term, it is either use of manic defense or regression to primary narcissism. But if it is manic defense, it will be more seen as a neurotic difficulty. But if it is regression to primary narcissism, it will be more seen as a psychotic difficulty, more likely. So now this is the tricky part of it. And you rightly pointed out that there is no line in the stone where we can classify clearly with clear scientific criteria what is a spiritual state and what is a psychotic state. There are two or three things. One, is the overall functionality impaired, or it is the same, or it has improved? Two, what is the general mood and quality of life of the person? Is the person, like in usual psychotic difficulty, there would be some anxiety, there would be some distress. Very unlikely that the person would be happy. There will be some disturbance of sleep, food, or something. So when you look at the overall functioning of the individual, in which you locate that experience, you can interpret that experience in the light of the overall functioning of the individual. And there, one difference can be made. The second difference is the person doing some intense sadhana, or has the experience forced itself upon the person without it? So
I think that's a very strong point here.
A very strong point, because here you have a person who was completely normal, who went out looking for experiences, and an experience happened. Now, again, there are two parts. The experience can genuinely happen, or the person can hallucinate because he cannot take his failure. The desire is so strong. That is where the guru becomes very important. It is the job of the guru to differentiate whether it is a genuine spiritual experience, or the man is making it up, he does not have any experience at all, or he is hallucinating in a psychotic way. So this is the very critical function of the guru, because he knows that after reciting this mantra and doing this yantra, A, B, C, D are possible, E, F, G are not possible. And A and D are possible more for X type of individuals, B is possible for B type of individual, and C is possible for Z type of individual. That is the job of the guru. That is where his skill comes in. That when he asks you to do certain mantras and japas and so on, and follow certain process and asks you to report experiences, what you report becomes important. And he knows what of it is genuinely on the path, what of it can be evocation of something abnormal or difficult, and what of it just cannot happen and the person is faking it. So that is where the right guru comes in. And then in that relationship, all the repressed desires, they come up and they are worked out. That is one way of transformation. The second way of transformation is converting something terribly unlikable into something likable. The third is getting used to something which is terrifying. And then lastly, to see something which you started off as seeing terrifying into something benevolent. So when we look at it, we are looking at forced transformation of fear, a forced transformation of ugliness and savageness into its counterpart of divinity and beauty. You are looking at a forced transformation of revulsion. We call attachment and revulsion. We are looking at forced transformation of revulsion into neutrality. We are looking at rising above attachment and revulsion. And we are looking at appreciation of divinity in a transcendent way. For example, there is no way you can start feeling love for something ugly and savage. But how the love develops is in two ways. One, behind that form, you see elementals that have created the form. And you see elementals creating everything. And the elementals come out of divinity. And therefore, the love towards those elementals, it is like, let us say you say all matter comes out of divine. And therefore, all matter is beautiful. Now, this matter comes together to create something ugly. Now, in that form, it is ugly, no doubt about it. But when you go to the atomic level, you can see the beauty. You suddenly forget the macro response to that macro form. So the response to that form transforms into response to its elementals. And when you start seeing that beauty and the divinity in the elementals that constitute everything, then everything seems beautiful, not because everything is beautiful, but because we appreciate the elementals, the beauty of elementals which constitute everything. So this is the transformation of seeing beauty in ugliness. That is one. Second is transformation of ugliness into beauty is by looking at the gunas or the qualities rather than the physical form. That beyond the physical form, you start looking at the qualities, and the qualities are of power, purity, immensity, holding of time, killing of evil, maintaining the order, and so on. So the qualities are all noble, but the form is savage and ugly. So how do you put the two together? There is a huge ambivalence. That physically a person is ugly, but quality-wise the person has a heart of gold. Now what do you do with such a person? So there is ambivalence. That you want everything together. You want attractive physical form and attractive qualities, but now you are given an ambivalence. So how do you navigate through that intense ambivalence? And the second perception of beauty and love comes is because of the unconditional beauty and love which evokes inside, which does not depend so much on the object. So that also is a form of transformation, that you can start loving that difficult to love object out of two things. One, out of love that flows from your love for elementals which constitute that macro object, or unconditional love has started inside, it's going out. It does not matter who is the object, because the object as it is objectively unlovable by physical form. From quality point of view, it is lovable. From looking at elemental point of view, it is lovable. From point of unconditional love flowing out, it is lovable. So you slowly move from the focus on the form to focus on quality, then focus on elementals, and then finally the unconditional positive effect coming out of yourself. So this is how, and of course, on the way there are powers and the acting of mantras and so on, about which I have no knowledge, but there must be a science. There must be, there is a science of the whole forms and sounds and the processes which are used, which create the transformation. And this is something we should learn from them and bring into psychotherapy. How sound can be used, how visuals can be used, how certain spiritual processes can be used, how certain substances can be used.
Substances as in psychedelic, or the nias and all what you're talking about?
The whole
different
range of
offerings.
psychedelic is a new word, but in India there is a very ancient idea of spiritual substances. The word psychedelic comes almost from a benign accidental discovery of something which was coming out of the drugs, as you call it. But in India, we have a very ancient tradition of spiritual substances. Substances which are to be used in certain processes to give you powers or transformation, which are used in yagna or puja or homa. One category. Second category is substances which straight away take you into a spiritual state, where sadhana can be done better. And third category, it can take you straight into the state of enlightenment, about which Patanjali talks about in Yoga Sutra, but we don't know what those substances are. Sorry, you were saying.
No, I was just looking at the points of transformation which you just discussed here with regard to fear, with regard to the dynamics of attachment theories and detachment thereon in a systematic, positive way. Then removing the ambivalence towards the physicality and elemental nature of the constitution of the sensory input and what the emotionally we feel around. What if there is a fixation in the personality with regard to sadism and masochism? And then if you bring in this Mahavidya there on application, psychoanalytic point of view, say, there is already a fixation. So there would be an over admiration towards this object of divinity. How would we tackle that there? How it will help in transformation? I know it's a tedious one, but
It's a very good question.
how we,
It's a very good question.
yes.
This takes us into this difficult but a very valuable area of relationship of experiences to transformation. Because experience can lead to addiction, experience can also lead to liberation. It is like, suppose somebody has a fixation in sadomasochism. Now, under the guidance of a right guru, when consciously he experiences this with due preparation and intention to get out of it, the same experience consciously done with right intention and preparation will lead to liberation. But if you do the same without intention, preparation, consciousness, and guidance of a guru, it will lead to further addiction. And therefore, people talk of two different things. That if you have alcohol addiction, some people will say slowly just give it up, and some people will say do it consciously. So this is a very important aspect, that the guru has to find out what tendencies the disciple has and how he should work on intention and being conscious, so that the Mahavidya practice leads to
UV, please. UV.
hello.
Yes, sir. I cannot see you.
There's some network issue. Just
Okay.
I can't see you. Can you see me? Okay, let me just complete this argument, this conversation that you have started off. The fixation that the guru finds based upon the strength of the disciple, the strength of his ability to be conscious, and his sincerity in the process, and his ego strength, the decision has to be taken whether to approach that fixation by consciously experiencing it or by distancing oneself from it and slowly allowing to taper away. So both options are there. In Mahavidya, the whole idea would be to confront it, because it's an in Mahavidya, the whole idea would be to confront it, so that to transform it forcibly. So that is the Mahavidya approach, and that is where I think the sequencing and the calibration part comes in.